Acute Hepatitis by Kimberly Argo, William Bennett, and Eric Skold. Acute hepatitis refers to inflammation of the liver. This may be caused by infections such as viral, bacterial, fungal, and parasitic organisms. Acute hepatitis can be caused by non-infections. This may include alcohol and drug use, autoimmune diseases, and metabolic diseases. Infected liver cells can lead to complications in liver function. Acute hepatitis hinders the liver's ability to produce bile that is essential for digestion. Acute hepatitis can make clotting take longer, affects how protein is metabolized, and affects the detoxification process of the blood and how vitamins are stored.
Over half of acute hepatitis cases are due to viruses hepatitis A, B, or C. The leading causes of non-viral hepatitis are alcohol consumption or exposure to toxins or drugs. Viral hepatitis is in the top 10 leading causes of infectious disease death worldwide. Over 2 billion people on the planet have been exposed to hepatitis B, with nearly 350 million of those people actively infected. 170 million people have hepatitis C. Here in New Mexico, over 45,000 people have hepatitis C. Fortunately, with vaccination programs, far fewer have hepatitis B, at approximately 5,000 individuals. With hepatitis C, it is anticipated 11,000 of those people will develop cirrhosis of the liver here in New Mexico.
Subjective symptoms of acute hepatitis may include a general feeling of illness, such as fatigue, lethargy, and malaise. The patient may also complain of nausea, anorexia, and a decrease of taste and smell. Many times, people with acute hepatitis also experience pain in the upper right quadrant. Objective symptoms of acute hepatitis may include dark urine, jaundice, vomiting, diarrhea, constipation, and an enlarged liver.
If acute hepatitis is suspected, LFTs or liver function tests will be performed. For acute hepatitis, the AST and ALT levels will be elevated, as well as the urinary bilirubin. Prothrombin time and INR will be extended, making the patient more susceptible for bleeding. Collaborative treatment for patients with acute hepatitis are the basics. They need to rest adequately to restore the body's energy needs. They need to maintain adequate hydration. They need to drink at least 2,500 milliliters to 3,000 milliliters per day. If they're unable to do this, they may need to come into the office or to the hospital to get IV therapy. They should have good nutrition. If they're feeling nauseated, they need to eat small, frequent meals. They're going to want to supplement with vitamins B and K. And of course, they need to avoid exposure to anything that is liver toxic. They need to avoid alcohol, IV drugs, over-the-counter medications such as Tylenol, and they may need to be changed from prescription drugs that are liver toxic, such as phenobarbital, phenytoin, glucosteroids, omeprazole, and sulfonylureas. As nurses, we need to monitor them for depression. Their blood glucose levels can fluctuate greatly. And we need to explain the need to the client for ongoing testing, including liver function tests and CBGs. Acute hepatitis medications include the hepatitis B vaccination series, which is very effective in preventing not only hepatitis B, but also hepatitis D. Newborns that are born to mothers that are hepatitis B positive should immediately be given the hepatitis B vaccine, as well as HBIG, or hepatitis B immunoglobulin, within 12 hours of birth. They're at high risk for developing chronic hepatitis. For patients that have acute hepatitis, that have arthralgia, myalgia, or headache, analgesia such as NSAIDs is often used, occasionally narcotics. Metoclopramide or Reglan can be used to treat nausea. For pruritus or itching, ursodeoxycholic acid or UDCA is often given. For hepatitis C, it can be treated with interferon and ribavirin. The ribavirin is given once a day, and the interferon is by injection once a week. This is for 24 to 48 weeks. It's only about 50% effective, and it is very costly and has many side effects.
Nursing diagnoses play an important role in the management of patient care. For acute hepatitis, there are many nursing diagnoses that can be applied to reach the desired outcomes. One of the nursing diagnoses is acute pain related to edema of the liver. The nursing diagnosis may be evidenced by several indicators presented by the patient. Some of these include, but not all, are right upper quadrant tenderness, headaches, myalgias, arthralgia, nausea, and vomiting. An individual with acute hepatitis will typically experience fatigue. The fatigue is a result of malnutrition. The nursing diagnosis, fatigue related to reduced metabolism, is another example associated with acute hepatitis. This nursing diagnosis may be evidenced by a patient reporting lack of energy, increase in physical complaints, and impaired ability to maintain usual routines. The liver's inability to metabolize nutrients is an indicator of a possible infection. This infection can be a result of one of the hepatitis viruses. The last nursing diagnosis discussed in this presentation is imbalanced nutrition, less than body requirements related to impaired metabolism. Imbalanced nutrition, less than body requirements related to impaired metabolism has several as evidenced by possibilities. These possibilities include loss of appetite, nausea and vomiting, weight loss, and weight gain. These indicators provide evidence which in turn are used in establishing the plan of care for a patient diagnosed with acute hepatitis. There are varying degrees of complications associated with acute hepatitis. Although acute hepatitis A resolves in 1 to 2 months, acute hepatitis B can take up to 3 to 4 months. One complication associated with acute hepatitis B is fulminant hepatitis. Fulminant hepatitis, or massive hepatic cell death, is a life-threatening complication. Other complications can lead to chronic hepatitis and cirrhosis of the liver. 5 to 20% of all cases of acute hepatitis are related to cirrhosis of the liver. Esophageal varices are also associated with acute hepatitis. Additional complications include portal hypertension, viral co-infection, and liver cancer. Portal hypertension is a result of the liver's inability to filter blood, therefore blood cannot return to the liver from the digestive system, resulting in increased pressures. Viral co-infections occur as a result of the immune system's already weakened ability to fight off other viruses. Hepatitis makes it difficult to fight secondary infections. One example is human immunodeficiency virus, HIV. Liver cancer is a complication of cirrhosis, in which 80% of all cases are associated with hepatitis.